Among the troubling side effects of the pandemic is the lost ground in addressing other health concerns. Among the most urgent of those are screenings for cancer. In response, the American Cancer Society is trying to make up the lost ground with help from the NFL and the New England Patriots. To tell us about the efforts being supported locally are an internal medicine specialist with the Codman Square Health Center in Dorchester, Dr. Rachel Hindin, and a family physician at the East Boston Neighborhood Health Center, Dr. Karin Leschly. I'd like to thank you both for being with us, doctors.
Thank you, Chris.
Yeah.
I want to start with Dr. Leschly in East Boston. Uh, Tell us about the context for this effort, whether it's in terms of the population you serve or how big the backlog is in some of the other health concerns.
Yeah, Chris, COVID has really hit our community hard this year. We've had a lot of our community has had COVID and has been too sick to come in and get routine screening. We've actually seen a decrease in about 15% of our patients touching the health center, and all of our screening rates in cancer have decreased. One of the cancers that we'll be focusing on with this grant is our colorectal cancer screening, and we've actually seen over a 10% decrease in the number of our patients getting screened in the calendar year 2020.
Dr. Hindin, what about Common Square in terms of the population you serve and how far things are behind as far as screenings?
So similar to what Karen noted, we've experienced a real drop-off in cancer screening, colorectal as well. We noted probably about a 20% drop-off in our screening rates. And even before the pandemic, we weren't necessarily where we necessarily were aiming to be. Colorectal cancer screening is incredibly effective at detecting our early cancers and really being a essentially preventable disease if caught early. So really trying to get back to that work of that critical screening to address what was already, disproportionately affecting our community health center. So the combined effect of the disproportionate burden that the health center community has borne in terms of the COVID pandemic, as well as the underlying disproportionate burden of cancer that is in the community. The two of those together have made this a really incredibly important moment to try to get back to some of those screenings.
Dr. Leschly, at East Boston, you're focusing on more than one kind of cancer. Can you tell us a little bit about what you're trying to do?
Sure. We're going to try to focus on screening rates for colorectal cancer, screening rates for breast cancer, as well as cervical cancer. So with the funding from this grant, we've hired a cancer navigator who is going to really help us run reports of all of our patients who've been lost to care and are behind in these screening rates, and basically make personal touches by outreaching these patients and calling them, educating them about the importance of these cancer screens and how if cancer caught early is treatable. And so we really feel by having someone call patients and talk to them about these screens, bring them in for the pap smears and mammograms, but also send them cards that you can do colorectal cancer screening in their own home. So we're really hoping to use this money to hire, well, we've actually hired this person, and she started last week and has already started making some of these calls, which is something we haven't been able to do before because we didn't have the funding to do it.
Dr. Hindin, your focus is really on one thing, colorectal cancer. Why is that?
So again, it's something that when caught early really can be cured. And the screening test really is so simple. Many people are familiar with colonoscopy as a screening method, which is a much more involved process. It requires taking time off from work, having somebody to take you to the hospital. And for some patients, that really is the necessary test. But for the vast majority of the population, a simple home test that we have developed a system, thanks to this grant, to have a navigator mail the kit to the patient at home. So it is simply providing a stool sample, mailing it back to the health center. And with this simple test, we can, identify individuals who may be at risk or have cancer. And really great to be able to do it in such a easy, accessible way. No time off from work, no preparation needed, simply completing the test essentially at the time of using the facilities.
Dr. Leschly, the population you're trying to serve, I imagine some of it is, are, people who have a good rapport with the health center, which is what health centers have always been trying to do for quite a while. But on the other hand, you got people whose lives have been disrupted. They might have lost a job. They might be immigrants worried about eligibility for care. How do you reach people like them?
We reach everybody at all times. I think, I don't know if I quite understand your question. I'm sorry.
Well, I think you might want to reach out to people who haven't been to your health center before. So what about them?
So we aren't able to reach folks who have not come to our health center before in terms of our Cancer Navigator, but we are using our HR department to blast emails as well, not emails, but use social media as well as advertisements in the newspaper to encourage folks to come in and seek care. But in terms of our Cancer Navigator and knowing if folks are overdue for cancer screening, we aren't able to know about that unless they have come in and accessed our health center.
Yeah. Dr. Hindin, what about Codman Square? If people haven't been there before, or if they're worried about things changing in their lives as far as medical coverage, what about their ability to take advantage of these screenings?
I mean, we are open for business. We have seen lots of new patients coming in. So yes, as patients' insurance and job status change, we are open. We love to see anybody and everybody who is interested in coming here. Always taking new patients, and we would love to see people and get them up to date on their screenings. And hopefully, as part of this effort, thanks to the support of the grant, hopefully just getting more information out in the community about colorectal cancer and the importance of timely screening. And we hope that will motivate individuals who may not have been in touch with the healthcare system for some time to actually come in so that we can partner with them to address the necessary screenings.
Dr. Leschly, I can imagine that when it comes to the virus, there are much more risky settings than community health centers, but people have been staying away from primary care for the past year or so. So what can you tell people about new protocols or precautions that maybe might reassure them if they do need to come in or something?
Sure. We have taken all protocols and all precautions to make it safe to come to our health center to receive your care. We screen at the front door, temperatures, masking, appropriate hand washing. We have spaced out visits such that folks don't have to wait in the waiting room anymore, and they're escorted to the room right away. And then additionally, more cleanings are done in all of the facilities here. So I really feel we've gone above and beyond in terms of making sure things are safe for our patients, as well as just educating patients about what we have done and really encouraging folks to come back in and get care. We want to see them.
Right. Dr. Hindin, what about Codman Square? Some of the things that you're doing differently now?
Sure. So similar to what Karin mentions, very tight screening protocols in place for when patients come in the door, screening, and we have helping patients in whichever setting they need to be seen in. We've also done a lot of work with telemedicine over the past year. So we are serving many patients, but also through different modalities, which also helps, allow for more spacing and the facilities to feel less crowded. So even when we talk about cancer screening, much of this, your colorectal cancer screening, we can talk to you on the phone. We can get that kit mailed out to you. Obviously, if there are other medical issues that we need to do or see you for in person, we would love to see people in person for that. But for individuals who, may not feel comfortable yet, even with their very good and safe protocols in place, there are a lot of opportunities for engaging with the healthcare system virtually. So we would love to hear from new and old patients who would prefer to use that mode of healthcare for now.
Dr. Leschly, I know, I think both of you have mentioned that screenings lead to earlier detection, and that's good for people. How much of a difference can that make? I mean, when you talk about the odds of staying alive and beating cancer, how important are these screenings?
Very important. I can't stress the importance of early detection, in that the earlier we can treat a cancer, the more likely we are to have better outcomes in terms of morbidity and mortality. So early screenings are really important.
And finally, turning to Dr. Hindin, if people want to follow up, maybe trying to make an appointment or just get some help over the phone or on a Zoom session, what's the best way for them to reach you at Codman Square Health Center?
Please just give us a call at the main number, 617-825-9660. And we would love to connect with you, in whichever way you feel is the right way for you right now to get connected with a healthcare provider to address your health needs. So primary care is critically important, all the more so now, 11 months into this really challenging pandemic.
And Dr. Leschly, at East Boston, if people want to follow up, what's the best way over there?
No, absolutely, and I think returning patients and new patients as well. We welcome everyone in the community. The main number to reach would it be 617-569-5800. That is our patient services, and everyone is welcome to receive their care here.
Well, thank you both very much for taking the time to join us.
Thank you, Chris.
Thank you.
Thank you. That was Dr. Karin Leschly from East Boston Neighborhood Health Center and Dr. Rachel Hindin from Codman Square Health Center.